Hi, everyone. Welcome again to today's webinar, Tips for Completing the Managed Care BHIT Organizational Self-Assessment. Thank you again for joining this afternoon. So before we get started and dive into the tips that we have for completing this self-assessment, we want to first provide you an introduction, some housekeeping items. First, an orientation to the WebEx system so that you can all participate to the best of your abilities. So please note that upon joining today's webinar, your microphones have been muted and your phone lines have been muted to avoid any background noise. So if you would like to communicate with us, and we encourage you to communicate with us, please use the chat box feature. This is located at the bottom of your screen. If you hover over the PowerPoint presentation, you'll see some task bubbles appear at the bottom. You can activate the chat box by selecting the dialog bubble. The next item we want to just highlight is that we will be having a Q&A section of today's webinar. So please, again, submit your questions via chat box. Also, the slides and presentation recording from today's webinar will be posted to our website, ctacny.org. It will take about 2 to 3 business days. Since this is a private cohort of providers, we will be circulating the training page link to all providers, so please anticipate that in your inbox in the next couple of days. Also, questions that are not addressed today will be addressed in future trainings and presentations. And if any questions come up after today's webinar, please feel free to submit them to mctac.info@nyu.edu. That email address will appear on future slides as well. And also to highlight, we will be hosting office hours a week from today on December 19th at 3 p.m. to 3:30 p.m. So please feel free to join to ask any outstanding questions that come up once you have spent some additional time with the Managed Care BHIT OSA. So my name is Brianna Gonsalves. I'm a program associate here at the McSilver Institute, where we have the Managed Care Technical Assistance Center. I am joined by my colleague Patricia Quintero, who will really walk us through those specific tips for being able to complete the Managed Care BHIT Organizational Self-Assessment. So an overview of today's presentation, we will go over the BHIT provider funds and activities. So we have our OMH colleagues here on the phone with us, and they will walk through that funding and the activities that are associated with this project. We will provide a brief overview of who we are, who the Managed Care Technical Assistance Center is. Then Patricia will really dive into the Managed Care BHIT Organizational Self-Assessment, run through the logistics and some recommendations, as well as we'll discuss our past experience and provide some tools and resources. We'll provide an overview of the timeline and next offerings, and then we'll open it up for Q&A. So I'm going to turn it over to OMH now to provide us with an overview of the behavioral health information technology activities.
Hello, everyone. Thank you so much. My name is Claire Rudolph. I'm with the New York State Office of Mental Health. A lot of you have probably seen emails from me, so thank you all so much for taking the time to join us today. So you all have been selected to participate in this funding opportunity because of your level of Medicaid billing and because of the fact that you're designated to provide the new Children and Family Treatment and Support Services, or the newly aligned Children's Home and Community-Based Services. If anybody is not a designated provider or plans to de-designate for these services, please let us know, because that means you will not be able to participate in this funding. This funding is really designed to assist agencies with BHIT, Behavioral Health Information Technology costs, in preparation for the move to Medicaid managed care. And a big part of these funds are these trainings that we're going to be doing with MCTAC. There's a couple of webinars that Brianna talked about. There'll also be in-person trainings across the state. And there'll also be one-on-one technical assistance that MCTAC and or their consultants will provide that'll really help your agency think through the best ways to spend this funding, whether it's purchasing or upgrading your own BHIT system or potentially connecting with another agency or organization to help with that billing. So that's a big piece of this. If you could go to the next slide. So some of the key deliverables. So the first letter that you received from us on November 16th saying, hey, you're eligible for this funding, clearly outlines all of these deliverables as well. But the first one is that you need to complete the managed care BHIT organizational self-assessment by the end of this month. So that is what this webinar today will help you do. It will help provide some tips and a little bit more information about the OSA itself. After that, there'll be about a month where MCTAC will really look through the results of those and see what everybody says and kind of get their data together on which areas it seems like people are really feeling good about, which areas people might need more help. And based on that analysis, there'll be the in-person trainings that I mentioned throughout the month of February, potentially into early March, depending on the timing of things and when we can find spaces. But there will be regional trainings in February and possibly early March. You will just be asked to go to one of those based on whichever one is closest to you and your availability. And then after that, there'll be the one-on-one discussions with MCTAC and or their consultants that'll be at your agency to think through the results of your assessment after you've had the discussions with the group, and then really individually, what makes the most sense? How should we spend this money so that we can really be best prepared for this transition? And we'll just ask that all of the funds are reconciled and spent by the end of June 2019. So in terms of actual deliverables, it's, again, completing the OSA and then participating in the trainings. And that's it from us for now.
Great. Thank you so much, Claire. And so just to highlight a couple of things that Claire mentioned, so MCTAC is really here to provide you all with the support to really be successful in this project and to really think through how to best utilize this funding opportunity. So MCTAC is a training, consultation, educational resource for you all. So we continue to provide resources to all mental health and substance use disorder providers across New York State, both on the adult side as well as the children's side. And our overall goal is to really help to prepare and assist providers with the transition to Medicaid managed care to be successful in the new climate. And again, our role in this project, first and foremost, is to create, deploy, and analyze the results from the managed care BHIT organizational self-assessment. So it will really be helpful for you all to look at your own organization's results and to identify those areas of need to focus on over the next few months. And then we're also here to coordinate and develop those in-person and web-based trainings for educational opportunities, as well as to create those connections with the consultants, as Claire mentioned, that will be helping to facilitate through this project as well. So I'm going to turn it over to my colleague, Patricia Quintero, to walk us through the organizational self-assessment.
Okay, fabulous. Thank you so much, Brianna, and thank you for the introduction. It's a pleasure to be with you all today, and I look forward to your questions and how we can be of assistance throughout this webinar. So let's start with an OSA. What does that stand for? So OSA is an acronym for an organizational self-assessment, and you may be asking yourself, what is that? And so organizational self-assessments, if you look at, the Kennedy School for Nonprofits or things like that, these are tools that are built specifically by initiative, and they are built for the organization to take a hard look at itself in the mirror and to assess where it stands for the project in terms of strengths and in terms of areas for growth. And so for this organizational self-assessment, we are asking organizations to reflect, to come together as a team, and to agree upon and state where the organization as a whole stands in terms to this transition to managed care. What exactly is the purpose of this OSA? the purpose of this OSA is to really help organizations through the completion of this assessment really get an idea of where you stand, what are your areas that perhaps you need to devote a little bit more time to, and what are the areas that you really begin to excel at, so that as you prepare for those activities, you can really understand what do we need funding for, how do we move forward, and what are other things that we need to implement in order to make things really work. And so that is the purpose. And then how will this MIC BHIT OSA be used to benefit your agency? And really the answer to that is two-pronged. One is that the information and the aggregate results as well as the individual results are going to be shared with our partners at the OMH office, and that is going to be used so that in coordination with our partners at OMH, we can create trainings based on what we understand to be the areas where there is the biggest need for growth across all those agencies. So we really want to say, hey, how can we help? How can we provide targeted technical assistance? And then the second thing is that, you know, while you may be completing the self-assessment and you have an idea, it's really great for you to have an understanding of where do I stand and where do I stand in relation to the rest of the cohort. And so we'll be going over that next benefit for you in a bit, which is really each organization, you know, at some time period after the completion, will receive an individualized report. Well, you will see by domain where you score, how you score against the average and the rest of your cohort, and then what are those areas in which you might need to devote some more time to. Oh, sorry, excuse me 1 second. Okay, perfect. So logistics and recommendations, before you begin this organizational self-assessment, what do you do? How do you start? The first thing is just double check that you have it. You may have received a letter and you may have received information from this webinar, but did you receive your link? And the reason that that's important is that we have crafted separate links for each agency so that we can track and that we can verify that the information that we receive is indeed from each organization. So if you are working or have a good relationship with another agency, please don't share links, because that's why we have created separate links for each. And if you did not receive it, please email us right away at mictac.info@nyu.edu. That way we can assist you and we can make sure that you received it. The next thing that you want to do is, it's a rather large organizational self-assessment. There are different domains. We have scales. There are different components that you'll need to understand. That way you can complete it as accurately as possible. So we have crafted all that information for you in one easy-to-read instruction sheet. Please read through it separately. You should also be doing this with a team. So, throughout these transitions, if your organization does not already have a team that is responsible for this transition, get a team together, look at the domains. You really should have people that are spanning across program implementation, to finance, to billing, to people that plan utilization management. Really look at those. You definitely want to include IT. I cannot stress that enough. And really get them together, get yourself in a room, get some coffee, and talk through the questions. That way you can understand where you stand. A lot of the times we tell people, hey, if your department has not gone through this transition, it's quite possible that another department in your team has. So please reach out across the aisle to other people on those teams. That way you get the most accurate view of your organization. You may find that a lot of that knowledge is already in place. And the last thing that we state is to please, we have provided a PDF version, and so this will allow you, this will allow for the facilitation of the questions. This will allow for you to guys really go back and forth and decide. That way when you go into the link, you can just input all of your answers and record them, and it's less strain on your team. Just so that you know how the survey works, you don't have to complete all the information at one go, although it is recommended. We do recommend that you go through it with your team. you answer all of the questions first on the hard copy. If for some reason you need to go back, you can go back. You can go back to past answers and change them if you find that the information is now, you're interpreting it differently. You will see that questions are enforced, so we really do need all respondents to answer all the questions based on what they have selected. So you will not be able to complete the survey unless certain questions, so you'll see little messages and little asterisks or exclamation points explaining to you what questions need to be completed. And then at the end, you will see a message at the end of the survey saying, hey, you have successfully completed your survey. If for some reason you need a recording of the date and time, like we said, we are always available for that, and you can email us and we can send you whatever information that you might need should you have to send that off to leadership or anyone else on your team. So a little bit more of logistics and recommendations based on our past experience. Just to note that the deadline for this is December 31st, 2018. Please mark that on your calendars. I do know that with this time of the year, people may be gone. So make sure that, as soon as you finish this meeting, if you have a minute, speak to your team, get some time on your calendar so that you can meet your deadline. I do know that the completion of this OSA is necessary for the receipt of funds. So please do keep that in mind. And I do believe that that also does include the timely submission of funds. So please take that into mind. Please use some time to plan now. And please use this as a resource because we do have some office hours next week. I do know that people have already begun emailing us. We are really good at getting back to people and answering your specific questions. So you have plenty of resources and we're here to help, and we want to make sure that everybody gets across the finish line. In terms of dissemination or what exactly, there's a lot of data, there's a lot of questions. What are we going to do with it? Just to iterate what I had said previously, dissemination or how we're really going to interpret the results is going to be through two mechanisms. One is that each agency will be receiving their individual reports, and then the state will be looking at individual reports, but also looking at the aggregate results. And like we said, we will be disseminating and explaining all of that to you at some point in the future, but we also will be working really closely with our partners to then decide how to go about providing targeted technical assistance for this cohort. Just iteration, I've said it previously, but I do want to make things clear. In the past, if you have completed OSAs based on what it was for, we did state that there was privacy. Given that this is an activity that is contingent or tied to funding, individual results are also going to be shared with the state government officials that are working on this project, so we want to make that very clear. And this is going to be used for the purpose of, creating that targeted technical assistance. And then once again, I can't emphasize enough, is that if you need additional assistance, please email us. It's not going to be some robot answering the question. It's either going to be Brianna or myself or someone else that is heavily trained and involved in this project to really answer your questions on a timely basis. So you've noticed that I have talked about OSAs in the past. And so, if you are new to this and you haven't heard of this before, we do want to reassure everybody you are in good hands with both the state and with us. Here at the Managed Care Technical Assistance Center of New York, we have been working with the entire state's agencies or consortium of agencies since 2014, as we have been working on the transition to managed care. So that includes all of our behavioral health agencies, both mental health and substance use. And we have done a number of these OSAs in the past and have used this to create both tools and resources and trainings to help guide you along the path and successfully transition to managed care or any other major policy updates that are happening. So that's a little bit of our experience. Once again, to kind of help you, get some incentive to complete this other than the funding, is that really this is a golden opportunity for you to understand where your agency is. You will not only be receiving an overall aggregate score, but you're going to see where your agency stands in terms of each domain. So where do you stand in finance? Is your area of growth maybe IT or billing or utilization management, or is it data and continuous quality improvement? So our agencies have stated how these tools have been helpful, not only with working with the transition and working with us, but also if they end up employing individual consultants, because it gives them exact steps about what needs to happen. It's been especially beneficial, and we've had the pleasure of working with many departments within our state offices, because we can understand or, go to meetings and understand what people may say, but it's a really great way in terms of data to look at it as a whole and really understand what does the system need, where are loops that need to be tied in, and how do we go about that understanding all the intricacies of our agencies that are working on this change. And like I said, the most important thing that we can't emphasize enough is that this information is really going to be used to give something back to you that's going to be helpful. And for us, that's going to be resources and targeted technical assistance. Okay, so now that we've talked a little bit about the logistics and what it means, what is this organizational self-assessment, what is it going to look like? And so here we have the 11 domains. And so these are the 11 areas, and each area is going to have a number of questions. The number of questions is going to vary across each of the domains. And the questions will either be fill-ins or multiple choice, or we're going to have a scale where you can indicate where your agency currently is. And so you can see that we're covering topics such as what is your current involvement with managed care, where are you in terms of contracting, IT systems, utilization, member services, quality management, finance and billing, so on and so forth. And like I said, you'll be receiving your scores for each domain. You'll understand where you stand in terms of your cohort, so what is the average of your cohort, so that you have it as a benchmark, and then you'll get your overall score. And of course, when you receive those scores, we will also be providing assistance as how to read and interpret those results as well. And a little bit about data collection and analysis, and so some of this I've said previously, but just to iterate once again, all the information will be submitted online. It's through a data analysis system called Qualtrics. It's very much like SurveyMonkey, if you have any experience with that. And so once again, if you have not received that personalized link, please do contact us and we'll be happy to send you a new link or send you the past link. We will analyze the data. We're gonna, specifically with this OSA, we're gonna measure how ready are you within each of the domains and as a whole, and what are the areas in which we could provide targeted technical assistance. We are gonna keep all stakeholders informed throughout this process. So once we receive a report and we've examined that with our partners, we'll be working with all of you to understand what that means and then be providing targeted technical assistance. And that will be in small group trainings and webinars and activities as deemed as necessary based on these results. So that is a little bit about that. If you have any questions through any of this, I know that we have a Q&A section later on within this presentation. So I'm now going to pass the ball back to my colleague, Brianna, who's going to go through a little bit more about the next steps for this BHIT OSA.
Thank you so much, Patricia. So before we get to next steps, just a couple other things to highlight. Patricia mentioned that we did circulate an instructions guide along with the Managed Care BHIT Organizational Self-Assessment. You can really utilize these resources or that resource to, one, identify other key members to help fill out the domains. We provided a table of our recommendations for the key stakeholders from your organization that should be around the table when completing the Managed Care Organizational Self-Assessment. But we also provided a list of some tools and resources that we currently have on our website that might be useful to you in continuing to think about your status and your next steps in the transition. So we have a glossary of terms that you might find useful throughout the OSA. We did do our best to define some terms that we thought might be new, or we wanted to make sure that all providers are on the same page about the terms that we were speaking about for those specific questions. But if some terms are still unclear, please use the glossary of terms as a resource. We also have the Pen Guide, which is an organization cheat sheet to managed care contracting. So this is really to start to think about that contracting phase. We also have a Medicaid managed care readiness assessment work plan development tool, and then an MCO plan matrix for your to help support you and your organization. So then getting into the timeline and next steps a bit. So where we've been, you all received the managed care organizational self-assessment on November 26th. As Patricia mentioned, if you didn't receive it, please reach out to mctac.info@nyu.edu, and we'll make sure that you have that link. Today is the 12th, and we are hosting the tips for completing the BHIT OSA webinar. We'll be hosting office hours a week from today at 3 p.m. The deadline for submission of the OSA is December 31st. We will have individual provider assessment reports in early February. We'll provide continued TA opportunities throughout February and March, as well as individualized TA. So now I'll stop with our part of today's programming. We'll turn it over to you all to address your questions. We have received a few, so we can just jump right in, but please continue to submit your questions through the chat box feature. Again, if you hover over the PowerPoint presentation, you'll see a dialog bubble at the bottom. Select that, and you will then the chat box functionality will appear on the right-hand side of your screen. So to get us started, we have a question around the capacities of Qualtrics. Okay. So can multiple people from an agency use the link to update the BHIT OSA? For example, a program manager answers the questions on page 1 and 2, then someone from IT at another location at a different time can see those answers, add answers to technology-specific question, and then submit the OSA?
That's a really great question, so thank you. And it really iterates sometimes how agencies work, and I understand that sometimes there's multiple locations and that the teams may be separated by location. I can say that the Qualtrics is very flexible and you can log on multiple times. However, given the fact that their questions are enforced, some people might not be able to get onto it or be able to answer those questions until other questions have been previously answered. So it would take a lot of coordination between people and scheduling their dates and times and sending it. I also do know that sometimes for security reasons, once a link has gone through multiple servers, if you're at different sites, that can cause the survey to freeze and then you can't get back into it. So really my best recommendation would be to maybe take the PDF, turn it into a working document, assign those portions, have people submit their pages by a certain time, and then have one person on your team be responsible for the submission. So they're going to be responsible for opening the link, going on to the survey, and then submitting all the answers. I can really tell you that that will make it a lot easier. We did have this experience with in the past, and what has happened is that the survey has been lost because it's gotten locked, and then the only way for people to resubmit is for us to generate a new link for them. So I wouldn't recommend this practice, unfortunately.
Thank you. And then we received a similar question around is the questionnaire web-based? So I think that answers that question.
Absolutely.
Great. So another question that has come in, so are the results of the OSA, does it impact the amount of funding that will be received? So OMH, do you mind answering that question?
Hi, the results of the OSA will not impact the amount of funding. This grant is for $25,000 per agency, and that will not change based on the results.
Perfect.
Thank you.
So we really can't emphasize answering honestly and truthfully so that you really can understand where your agency stands in terms of the transition. I think that's the real goal here.
Great. So another question that we have received, what are restrictions / next steps once the assessment is submitted and the results are received? So OMH, I think that one would best be answered by you all.
Hi. So once the results are into MCTAC, as we said, it'll be about a month. It'll take MCTAC to look through all of the results, and they do a great job of really digging deep and comparing the results, and they'll kind of help us think through what the topics of the in-person training should be based on the results of the OSA. So you will receive your individual summary report from MCTAC, and then there'll be in-person training. So once you submit the report, that will also trigger your payment. So submitting not the report, the OSA on December 31st, and then in early January, your payment will be processed, and the in-person trainings will start in February.
Great. Okay. Another question that we have received. So this is pertaining to the assessment directly, but something I would like to know about the use of the funds. I would like to know what types of equipment / services could be paid for using this money. My agency was wondering if Wi-Fi service would be something that could be covered, or is that something that wouldn't be allowable?
To our friends at OMH, any feedback or advice that you can give to these agencies that are considering activities such as this?
Yeah, hi, this is Eric Weiskopf. What I would recommend is that any purchase for technology that you should be avoiding things that are going to require some sort of annual membership or ongoing fees, because this money will run out fairly quickly. So in the example of a Wi-Fi where you might have to have a monthly subscription, you know, this would clearly not be enough to go have ongoing expenses. If there's an initial fee for the purchase of the item, you could certainly use that. So if you had to purchase a cell phone or purchase you know, some sort of a unit that will help you with Wi-Fi, but I certainly would not plan on having anything that is an ongoing cost for this. These are more like one-time costs.
And there's more details in the letter that was sent on November 16th about the kind of some of the guardrails around the funding. And then I'll also just reiterate that the MCTAC and their consultants, the individual kind of one-on-one trainings that will happen, they'll really help you individually think through the best way to spend this money. So it's good that you're thinking about it now and getting the juices flowing, but those conversations are going to be critical to making sure that you're using the funds in the best way for your agency.
Perfect. Great. Thank you. So another question directed towards you all at OMH. Do you know if there is a start date for this grant? Will invoices dated in November be eligible for reimbursement with these funds? Yes, sorry. That's it.
Thanks, Brianna. So the start date for the funds is the date that the letter was sent out, so that would be November 16th. That would be the earliest that we'd want to see any of the funding spent. But again, I'll just reiterate that we really would hope that people will have these conversations with MCTAC and using the results of those conversations and the OSA to really look at where the money can be best spent, because as Eric said, you know, $25,000 can go fairly quickly, especially when you're talking about technology purchases. So it'll really require some critical thinking on the best way to spend the money. But the start date, it will be November 16th.
Great. Thank you so much. Our next question, We have not yet received the links as noted in this training. So for the person who asked that question, please email mctac.info@nyu.edu and we'll make sure you receive those links.
Please say your agency name.
Yes, including your agency name. And we'll also work with you in the background to see if for some reason there's some blockage from the server that's not allowing for our emails to reach you, so we can work through that with you. All right, so our next question, this is for Patricia. If the question asks, can you do something, and your EHR is capable of doing this task, but the agency does not have it configured to do it, do you answer yes or no?
Oh, that's a hard question. Well, I think what is the big answer here, and of course, if any of our partners at OMH want to iterate or have another idea, we're open to that as well. But really, we're looking at what I would like to say is what is your current functionality, what can you do now? And the question, there are different questions. There are questions of capacity. So if your EHR has the capacity to do these things, whether or not you're currently doing them, I think that's different than whether we're asking you at this moment, are you collecting this? Does your EHR push out data? Does it, is there data coming in? That is a very different question than what is, what is the capacity of your EHR? Because as we know, some functionalities are the same, but then they can vary based on your system. And as we know that sometimes, you may have the capacity, and that's really important, but sometimes it takes a little bit of understanding of what exactly is going to happen with the transition so that you can configure them correctly. So I think that we're also taking that into account when you're answering the questions. I hope that was that was helpful.
Okay. So our next question that we have, this is directed to our partners at OMH. Will the agency be able to put the funds toward new purchases that we just made? We just put a down payment on a billing EMR.
Yeah, I'll take that. So again, Claire mentioned earlier that November 16th is the start date. So if you made a purchase, a contract date of November 7th, right, clearly we could not use these funds to support that. However, if you have additional purchases, add-ons, if you only purchase a documentation and now you want to bump it up to a billing, so you'd have an integrated documentation and billing system, and that happened after November 16th, you could use the money to support that purchase.
Yeah. Great. Yeah. People might think of that as customization, so that's something else to think about.
Exactly. So that was the end of the questions that I have currently received. If you do have any additional questions, please submit them through the chat box. I'm just going to move on to our next slide in the presentation. Again, please continue to feel free to submit questions and we can return to that. But I want to again reiterate that we will be having office hours in a week on December 19th at 3 p.m. To 3:30 p.m. So please join us during that period. Here is a registration link to join or to sign up, excuse me, if you haven't done so already. You will then receive a confirmation email with a link to join the WebEx. I will leave this slide up for a bit as I wait for additional questions to come in. But this again includes information on how to contact us through our mctac.info email address, as well as a link to our website where you can find some additional resources and tools that may be able to help you along the way. So I will stay on for a few more minutes as we wait for other folks to submit any last-minute questions. Okay, we have received another question. This one is directed to OMH. Can this grant be used to purchase tablets that staff will use in the field when visiting clients?
Yes, you can absolutely use it if, you just have to be able to justify that this is being used to support the services for the children's, and as long as you can support it. Now, that being said, tablets are pretty versatile, software is pretty versatile. So if you use this money to purchase tablets, laptops, that sort of thing, it doesn't mean that you only have to use it to support the children's services, but at a minimum, it has to be used to support it. That you could still use it for other programs as well.
Great, thank you. Again, we'll leave the lines open for another few moments, and then again, just reiterating once again that we are still available to answer questions via our email, mctac.info. So we received a question, where on the CTAC website are the tools that you mentioned? So if you go to ctacny.org, and I'm going to pull it up on my end so that I can walk you through it with some additional specifics. You can go to the Tools tab at the very top of your screen, and as well as the Resources tab. You can find both at the top of the web page. In addition, you can press the hamburger on the right side of the website's homepage, and you can click on the Tools and Resources links. If you continue to have trouble finding those tools, please feel free to email us, and we'll direct you to them.
We also have a search bar at the top, so if you know the name of the tool or you see it based on these slides, put that in, and our search function is pretty accurate in getting you to where you need to be.
Awesome. Great. So with that, I'd like to thank our panel for joining us. Those at OMH, thank you for joining us. Matricia, thank you for walking us through the MIC BHIT OSA. And thank you to all of our attendees for joining. Again, please feel free to contact us throughout the process if you have any questions that come up. All right, thanks everyone.
Have a great one, everyone.